know I haven't been on YouTube in a minute, but I am 1 week post-op, as y'all can see. I did get my top surgery done by Dr. Johnathan Keith, um, Newark, New Jersey, I believe. Yes. But he did my surgery in Livingston, New Jersey, and St. Barnabas Medical Center. What a wonderful surgeon he is. He keeps you very comfortable during the procedure. He keeps the patients comfortable. So he did a couple. I'm not the only one he did surgery on. So he did my top surgery only. No bottom, nothing like that. But he has done bottom, and people have no complaints with his bottom surgeries as well. So he does both top and bottom, FCM, MTF. So if anyone's in New Jersey, that's who I went to get my top surgery done. It's been 5 years. I did struggle trying to get it for over 5 years since 2015. I did my research before actually giving myself the biggest okay, because I know anesthesia has a lot of complications. And I didn't really get nauseous over anesthesia. No, I did. So, like I said, his staff members at his offices are LGBT friendly. They're here for his patients, you know what I'm saying? Like, surgical rep definitely is a part of something, you know. She definitely helped me try to get my top surgery approved, because my insurance company kept doing the most, doing a lot. Like, just, you know, I had declines here and there, and, you know, and she helped me put in that force to get the insurance to cover my top surgery. So, I seen 5 surgeons before him, and I've been discriminated. Basically, these surgeons was doing nothing but giving me excuses to not give me the surgery. They said the same thing, but they would be like, you know, I wouldn't hear from the surgical rep in their offices. And then, no, and then I had one that lost my top surgery letter. No. So when I went to him, I was referred by a friend. Everything went smooth, got everything. I was supposed to get surgery done with him last year, but my insurance terminated on me, meaning it cut off smooth. So yeah, then I had to do everything all over. But I didn't have to give her letters and everything. All she had to do was submit what she submitted last year, and it got approved again. So I was kind of excited, like I said. The procedure I did get, well, first we were going with Perry, but he didn't want my chest to look funny with one that looked like Perry and one that looked like double. It would make the chest look all symmetrical, all funny. It would look all funny. So, we went with double incision, because he just felt like, you know, since my chest was elastic, so it was a lot of tissue hanging, it was a lot of skin hanging. I wasn't born with it, but I was diagnosed at a younger age called breast cellulitis. And breast cellulitis, when there's, you know, something happens with one of the breasts and it's fluid, and it could either infect it or whatever, things like that. Y'all could research it up. I just want to make this shit short, you know what I'm saying? So, one breast was smaller than the other, so he pretty much was like, there's more skin for me to hide the incision, so why not do double incision and nipple grafting, and completely, you know, he did his thing on me. So I'm kind of excited. I did cry after the surgery, and I didn't mean to cry in front of him, but it was all happiness. It was happy tears and all. So like I said, a lot of people asked me, did I have to be off T? I had to be off T for at least 2 weeks prior to the surgery, which kind of messed with me emotionally. But at the end of the day, everybody knows some surgeons may require you or require you. But like I said, I hope everybody enjoyed the video. Thank you so much. It's your boy Cedric Jamal, and I'm out.